Good morning, everybody. This is David Cohn. I'm the Chief Medical Officer of the James Cancer Hospital, here doing a Facebook Live presentation discussing COVID-19, cancer, and cancer screening and prevention. I apologize for the technical difficulties this morning. I think we've got those worked out, and obviously this will be recorded for those that missed this because of the timing being a bit off, but we'll get to all the information that we need to cover today. So I want to first thank everybody for being here. Hopefully you found these to be educational and informational. To remind you, please add any questions or comments that you have as you go through this process, and I'd be happy to address any of them that I can. And if we can't get to them all, I'll certainly try to follow up with them on the next week's installment. But today we're talking about screening and prevention. Let's first start with some definitions. Screening, if you think about the process by which we are doing things to try to prevent somebody from getting a cancer. Let's talk first about the perspective of cancer as a whole, from preventing cancer to picking up an early cancer to treating a cancer. When you prevent a cancer, that's called prevention, obviously. Those are things that we can do of maintaining a healthy lifestyle or being in a position to eat well, exercise, maintain a normal weight. When it comes to early detection of cancer, that's the process that's called screening. And so screening involves testing where an early cancer is detected, at which point in time the prognosis and the survival would be expected to be the absolute highest. There's a lot of very common screening tests that are currently recommended by a variety of organizations, and these include screening for breast cancer with mammograms, screening for colorectal cancer with a colonoscopy or other types of tests, screening for cervical cancer with a Pap test or HPV test, and then there's screening for prostate and lung cancer as well. And when you think about the amazing number of individuals that get screened, it's estimated that almost 35 million women get mammograms every year, and about 20 million people get colorectal cancer screening with colonoscopy every year. So that's a huge amount. And again, the purpose of screening is to identify a cancer at its earliest phases, or even a precancerous condition that could be treated and eliminated, and someone would not develop cancer. Or if they do, that cancer would be detected at the earliest stages when the prognosis would be the highest. So why is this important as it relates to COVID-19? So as everybody recalls, when this pandemic began, there was a lot of changes that occurred at hospitals where our overall perspective was, let's do things like protect our personal protective equipment, make sure we have enough equipment to be able to care for patients when COVID surge increases to the point where we may not have enough equipment to care for our patients. So we wanted to eliminate any screening tests that might consume that protective equipment. Secondly, we wanted to make sure we had enough people to care for the individuals that would be coming in with COVID as well. So we wanted to avoid having these individuals tied up doing screening tests. And then third, we've talked a lot about controlling one's environment. And so we wanted to decrease the traffic that goes through outpatient settings or hospitals to minimize that probability of somebody becoming infected with COVID-19 that didn't currently have it. So because of those three things, we decreased the number of screening tests substantially at the beginning of COVID-19. And so when screening tests were canceled, where patients were called and said, I know you've got a screening mammogram or colonoscopy coming up, the recommendation was, don't come in for that. We will contact you in the future when things begin becoming somewhat back to normal again. And so here we are almost at the beginning of May, and there's discussions at a federal level and state levels and hospital levels of opening up our capacity back towards what it was before. And so it would be anticipated that individuals will be getting phone calls from their healthcare providers saying, we know we pushed back your colonoscopy or your mammogram. Let's come back in now and let's start the process of getting back into getting it on the schedule and going in for screening. The reason why that's important is because, again, the earlier that we're able to detect cancers, the lower the probability of somebody dying of that cancer or having an advanced stage disease that would require chemotherapy or radiation. So it's really, really critical that we get back to a place where colonoscopies and mammograms, Pap tests, prostate screening, and lung cancer screening, when appropriate, is put back on the schedule. So critically, critically important. The biggest fear that everybody has is that as a result of COVID-19, that delay in screening could actually lead to a later diagnosis of cancer. And obviously, we don't want to be in that position. So work on getting those screening tests back on your calendar. We'll work on our side of getting those tests scheduled again. But we both need to do our parts to ensure that we're in the best condition we can be to minimize that chance of having an advanced cancer that would require chemotherapy, radiation, or a worse prognosis. And that's the biggest fear. So if you've got questions at all about screening tests, is it appropriate to get a screening test, or what happened to that screening test that was scheduled, I'd encourage you to call your healthcare provider and ask them that question. I think that it is beyond the scope of this discussion today to talk about indications for screening. We talked about the main groups that should be screened, but certainly chat with your healthcare provider to ensure that you're getting that appropriate level of screening, and again, getting that screening at the appropriate time so that you're able to detect any precancer or cancer as early as possible to minimize those bad side effects. So the other question is it safe to get screening now? And I think that that's a really important consideration. We've talked a lot about, trying to stay out of hospitals, try to stay out of clinics, minimize the chance of becoming infected with COVID-19. And I think in this circumstance, there's a lot of information that we've learned about COVID-19 and its transmission that we're using to maximize the safety of our patients and our healthcare workers. And that means that, obviously you're going to see everybody washing hands, soap and water, or using hand sanitizer whenever appropriate, practicing the appropriate hygiene in terms of coughing into one's arm and not one's hands, just to minimize the risk for viral infection across the individuals. But then also where everybody's wearing masks. So everybody on the healthcare worker side is wearing a mask and a face shield whenever we're taking care of patients. And when a patient comes into our clinic, or someone who is coming in for a screening test, then they're also going to be wearing a mask to minimize the chance of transmission of COVID-19. So our hospitals and our clinics are open. We're increasing the number of tests that we're doing now. And again, we're anticipating that we should be doing more screening tests in the very, very near future. So you should anticipate a phone call from your healthcare provider in the near future to get those back on the books again, as well. So that's, I think, the main topic about screening. And then let's talk about cancer prevention real quickly. So what can we do in the context of COVID-19 that is what is going to be really important at preventing cancer? So minimizing the chance that a precancer or a cancer is ever going to develop. And we know that there's a lot of things that we can do in terms of general cancer prevention that's really, really important. And those are things like maintaining a healthy, balanced diet, getting appropriate levels of exercise. These things are kind of hard to do during COVID-19. And as everybody knows, we're encouraging people to be outside, to be doing it safely, physical distancing, wearing a mask, but get outside, get exercise. The sun's starting to come out in many places across the country. So that would be a great opportunity to actually be out and try to get that healthy exercise as well. Good food choices are really, really important. And again, that's really hard, I think, when many people are physical distancing in their houses, working from home, where food may be more abundant, or food choices might not be quite as simple as they were at the point in time when it was before COVID-19. So try to make good food choices. And good food choices means minimizing the chance of grabbing for processed foods. Think about a plate. Portion size is really important. So cut down on the overall number of calories that somebody gets. You should have at least 2/3 of your plate filled with fresh fruits and vegetables during a meal. Healthy, lean protein is really important as well. So that's kind of diet and exercise as a way to prevent cancer. And then there are a couple more things that absolutely should make sense that everybody should know about, and that is not to smoke. So smoking significantly increases the chance of almost every single type of cancer. And so decreasing smoking or eliminating smoking or avoiding cigarettes is really key as a cancer prevention. And then sunscreen is certainly a way to decrease the probability of skin cancer. And then certain vaccinations also help to decrease the type of cancers that people can get, such as cervical cancer with HPV vaccination, and then when appropriate, hepatitis vaccination as well. So those are the main pieces for cancer prevention. So healthy diet, regular exercise, decrease smoking, sunscreen, avoid sun exposure with a hat if you need to, and vaccinations when appropriate. So those are things that we can do to both prevent cancer from ever occurring, and then also for screening for precancers that could be eliminated or cancers that could be detected as early as possible so that we're not in a position to ever develop a malignancy. But I anticipate that in the near future, screening will open up again in our hospital and many others. And it's critically important that those screening tests get back on your schedule, they get back on our schedule as well, so that we don't have that burden of cancer that we're trying to avoid as we create a cancer-free world together. So I know I started late. I apologize. I'm going to take one quick question here, and then we'll pick it back up next week. So question came in is, are there types of cancer screening that could make COVID worse and if we don't have it? And so the answer to that question is no. There's no screening test that could make COVID worse or to cause someone who doesn't have COVID-19 to get COVID-19. Think about mammograms. Again, there's physical contact between a patient coming in for a screening test and the person administering that test. But we talked about the appropriate safety that's being used in all of our facilities to minimize the chance of anybody getting COVID-19, and that's masking of a patient, masking of a healthcare provider, face shield of a healthcare provider, hand hygiene with soap and water, hand sanitizer, and gloves. So the chance of somebody getting COVID-19 as a result of screening is not a concern at all. And as I said, we've learned a lot about COVID-19 through this process and believe that hospitals and clinics are a very, very safe place to be. We are open. And if you've got medical conditions that are coming up, we'd encourage everybody to seek out your normal health care providers, give them a phone call and see if screening is right for you and get things back on the calendar. So again, thank you everybody for listening, and we'll be on again next week. Thanks all. Be well.